This is a paper from 2020 that looks at COVID infection in the eye. Patients in the study had a COVID diagnosis between December 30th, 2019 and February 7th, 2020 at Tongji Hospital. This was a small retrospective analysis of 72 patients, where only two patients had conjunctivitis, and of those two patients, one had ocular discharge. And from those leaky eyes, they found COVID RNA fragments. Where even back in 2020, the authors came to the conclusion that to lower COVID nosocomial infection, all healthcare providers should wear protective goggles. And while the sampling seems low for those that have an eye infection with COVID, it's important to note that the major flaw in this study is that conjunctival sampling, eye sampling, was done 18 days on average. So that's 18 days after the infection is confirmed of COVID, where this time to sampling range from 6 to 46 days. So that's a very long window of doing this. So they probably just missed a lot of those eye infections. So for our one highlighted patient of interest, it was a 29-year-old nurse working in the emergency department in Tongji Hospital in Wuhan City. So this is close to that outbreak origin, where they had excessive tearing and redness in both eyes and no other symptoms except for moderate fever. And both the conjunctival and oropharyngeal swab tests for COVID were both positive. So both an eye and a nasal swab came up positive. Where on day 3, this is what the patient looked like. Day 7, it cleared up. And then day 19. So this is adding a lot of credence to the fact that because a lot of patients were getting sampled at day 18, they probably just missed a lot of these eye infections in their sample study. And not only did this patient have the eye infection, they also had ground glass opacities in the lungs, which brings us to that chicken and egg argument. So, is the COVID infection occurring in the eyes and then transferring throughout the system to the lungs, or is this a special case where the COVID infection was inhaled, went through normal progression, but also had ocular symptoms? What I'm trying to build out is that the eyes are one very valid route of transmission and that it can cause symptoms like in your lungs. So, based off of this study from a very long time ago, they said that the incidence of an eye infection with COVID is very low because only 2 out of the 72 got infected with it. However, even if it's low, that doesn't mean it's no risk. And the study, as we pointed out, did have a few flaws in it. So, in addition to masks, we should still recommend protective goggles or face shields to help protect hospital workers.